Welcome to the walkthrough of the CARE Act Data Dictionary. HMA is DHCS's training and technical assistance contractor for the CARE Act project. We provide project management support and technical assistance coordination to the counties. HMA also supports the CARE Act data collection and reporting, and today's training will be led by Charlie and Lauren Niles, both with HMA. Charlie is a data analyst and researcher with data collection, management, analysis, visualization experience in both clinical and patient care settings. Prior to joining HMA, Charles was a clinical research coordinator at Mayo Clinic Health System. In this role, Charles provided information to patients about open studies, managed research regulatory documents, maintained study and patient files, and created epic reports for open studies. Lauren Niles, our other presenter today, is an experienced and passionate healthcare quality subject matter expert and researcher. Dr. Niles' experience with development, specification, maintenance, and use of clinical quality measures for use at the state, managed care, and provider levels of accountability. She has a successful track record of designing and conducting health systems and policy research using mixed methods approaches. She also has significant experiences with stakeholder engagement and facilitation processes. She is a subject matter expert in behavioral health quality, including both mental health as well as substance use disorders. And she also is an expert at developing quality infrastructure models to support improvements within behavioral health systems. Next slide. So let's take a look at our learning objectives today. Our goal is that by the end of the session, participants will have an increased ability to navigate the CARE Act Data Dictionary. They will also just be able to describe which care respondents from trial courts, county behavioral health will track over time. They will also be able to distinguish the measurement periods for data collection and understand the structure and format of a data element to guide standardized reporting. Next slide. So we're here today because the Behavioral Health Information Notice and enclosed CARE Act Data Dictionary has been released. And this will provide guidance on the data that will be collected to help assess the CARE Act impact and monitor the CARE Act model implementation. And we're here specifically to provide background and an overview of the data dictionary for the CARE Act. And so during this session, we'll cover the following items. We'll provide an overview of the CARE Act data requirements. These will drive data collection and annual reporting. We will introduce the data dictionary and its purpose. We'll provide an overview of the data dictionary instructions to help you navigate the data dictionary. We'll also review the structure and format of data elements, including how to use specifications to guide standardized reporting. And then finally, we'll review the appendices, which is important information which my colleague Charles will review. So let's get our session kicked off today, and I'll turn it over to Lauren Niles.
Great, thanks, Serene. My name is Lauren Niles, and I'm a principal with Health Management Associates. On this work, I'm helping to support DHCS with the development of the data dictionary and the annual report for care. And as Serene just mentioned, my background's in behavioral health quality measurement and evaluation. We want to kick off this presentation by talking a little bit about the CARE Data Dictionary and giving you a broad overview. So if you go to the next slide, please. Great. We want to begin by briefly orienting you to the why behind this data dictionary. According to legislation, DHCS is required to develop and publish an annual report with specified information. The BHIN, the Behavioral Health Information Notice, has been released recently, and it provides guidance to the counties on data reporting requirements to monitor the performance of the CARE Act model. It's DHCS's responsibility to ensure counties are equipped to be able to collect necessary information, and as such, DHCS is responsible for developing a data dictionary to ensure standardized data collection, developing a data tool to collect that information, assisting with ongoing TA, and also ensuring data quality assurance. The data dictionary, which is the topic of our session today, outlines DHCS and county responsibilities for data collection and reporting, and all that goes to support the annual reporting on the CARE Act implementation. Next slide, please. This slide provides broader context on the data dictionary, and specifically DHCS's responsibilities related to reporting the CARE Act legislation. So there are two components. There's an annual report, which you see on the left side of this slide in that blue box, and there's also an independent evaluation, which you see on the right in beige. Currently, our focus is on the data collection and reporting to support the annual report. DHCS is in the process now of procuring the independent evaluator. For the annual report, we'll be collecting data to monitor the implementation of the CARE Act. This will include outcomes data to assess the scope and impact of the CARE Act, and also performance indicators with special attention paid to key demographic information to support disparity reduction efforts. Data collected for the annual report will feed into the independent evaluation, and DHCS is coordinating both efforts closely. Next slide. Now I want to dive in. So when you first get and open the data dictionary, the first thing you'll see is the table of contents. It provides an introduction to the data dictionary and gives instructions on how to use it. Please, as you do open this and get acquainted with it, pay attention to the instruction section as it contains really critical information for data collection and reporting. The table of contents points users to each of the required data points that will be submitted to DHCS. It also includes summary details and detailed specifications for the data elements that can be found in the appendix section. So we're now going to walk you through each of these sections in more detail to show you exactly what you can expect. Next slide. So the first section of the data dictionary is the introduction. If you go to the next slide, we'll talk a little bit about what's included in that. As you can see, it provides a brief introduction to the origin of the data dictionary and what is contained in the document. In this section, the Judicial Council and county behavioral health agencies can find more information about what's included in the data dictionary, the purpose and use of the data dictionary, and how it was developed. In the definition section, this is our first subsection, and you can see there's a summary or catalog of data elements, names, definitions, and attributes. This is going to serve as a quick guide to you to help quickly find the information that you need about the CARE Act data collection and reporting tools. The next section is related to purpose. The data dictionary specifies the structure and content of the data to be collected and reported per statute. Detailed specifications for the data elements and associated data points are included in the specification section, standardized reporting. The CARE Act data dictionary was developed to define the data elements and aid county behavioral health agencies and the JC in fulfilling the annual reporting requirements from the statute. And then finally, in the development section, you can find a bit more information on how the data dictionary was developed. Of note, significant efforts were made to align where possible with existing state data dictionaries, so things like Medi-Cal or CalOMS. For data elements where there were not existing definitions from the state or other commonly used programs to turn to, the developers relied on industry standards or evidence-informed typologies to fill those gaps. So next we want to walk through the instruction part of the data dictionary. If you turn to the next slide, the instructions provide information on how you can navigate and use the data dictionary to perform data collection and reporting. This is another section to review carefully because there's a lot of critical information in here that would help you understand the data collection, reporting responsibilities of both the courts and county behavioral health agencies. Next slide. Over the next few slides, I'm going to go into a little bit more detail on how data will be collected for the purposes of CARE Act annual reporting. The Judicial Council, or JC, is responsible for capturing and reporting on trial court data for all petitioned respondents. Importantly, the data the JC is going to be collecting and reporting on will be at the aggregate level, meaning that no participant level information will be collected. And as such, demographic characteristics of the individuals moving through the court process will not be reported by the JC. County behavioral health agencies are responsible for capturing individual level respondent data on petitions they initiate with Care Court and petitions for which the court orders them to investigate and file a written report. At the individual level, basic information, including demographic information for all petitions that flow through the counties, are required. For petitions that result in an individual receiving county supports and services, county behavioral health agencies are going to be responsible for tracking 3 distinct groups over time: clients with a care plan, clients with care agreements, and also clients who have elected to receive services. We'll talk a little bit about that more in the next couple slides. Thank you. Important to our conversation today is to briefly orient you to when we will actually be collecting data for the purposes of the care evaluation. There are 3 distinct periods of data collection or measurement periods. The first is care process initiation period. The county behavioral health agencies will only be asked to report data during this period once as a baseline, prior to the active service period where eligible care respondents are being served by county behavioral health agencies. As previously mentioned, county behavioral health agencies are responsible for tracking those with care plans, those with care agreements, and elective clients, who are those that are voluntarily receiving services outside of the court process. The next period is the active service period. In this period, counties will report on services and supports and other data through their graduation from a care plan or through the 12 months from the start of a care agreement or elective services. And I'll go into a little bit more detail on that in the next slide. But finally, the third period is the follow-up period, where counties are required to report data. Counties are expected to follow and report data on those clients who continue to receive county services outside care court for up to 1 year or discharge from county services, whichever comes first. On the next slide, you can see in a little bit more detail those 3 distinct measurement periods again, but I wanted to reiterate some differences between the 3 pathways and the measurement periods. So to reiterate, the active service period begins across those 3 care pathways when treatment begins. The active service period concludes when one of the following occurs, whichever is first: the termination of county services, graduation from the care process, or the 12th month of voluntary county services concludes. Termination or discharge is defined as the premature exit from the care process or voluntary county services. And then the follow-up period, just to reiterate again, begins at the conclusion of the active service period and continues for up to 12 months or when a client is discharged. Next slide, please. And this schematic here it's a busy slide, but hopefully, I want to point out a couple important things on this slide for everyone. The schematic shows how the care court data relates and intersects with county behavioral health agency data reporting. You can see that the JC and counties have distinct requirements for data collection and reporting. So in the light blue boxes, you can see the data elements that are required for aggregate level reporting by the JC. In red, you will see the data that both the JC and counties will be reporting. Importantly, the JC is going to be reporting at the aggregate level as a reminder, and the counties are reporting at the individual level. Reporting on individual level data is critical to ensure that we can conduct those thorough health equity assessments that are going to be really important for informing disparity reduction efforts. And finally, the navy boxes represent data that the counties alone will be reporting at the individual level. Care respondents who are determined ineligible and do not enter into county services are going to be excluded from reporting over time. However, counties are being asked to provide basic information about those ineligible care respondents via 3310 care status, which we'll talk a little bit more about later. Again, counties are not going to be tracking these ineligible care respondents over time. At this time, I want to turn it over to my colleague, Cha, who's going to be bringing us through the remainder of the presentation today.
Hi everyone, I am Cha. I am the data analyst from HMA. So I will be working on the back end to make sure that the data is right, and then also responsible for getting all the report out there to county and also to JC. Yeah, so I will be the guy working on the back end. Since Lauren covered the first 2 sections, I will finish the last 2 sections of the data dictionary. On here, you can see that it is a table. So on this table, it is actually the format for all the data point in the care data dictionary. Here we show you the format so you know how each data point will be reported. We have an example of a data point using this format, but we're gonna show that in a later slide. Yeah, Carly, next slide, please. So what should you do when information for a data point is not available? Specifically for any data point that are date variable, when information is not knowing, we want you to use what? 09 as what? As the day, 09 as the month, and then 9 and 9 as the year. Yeah. Sometimes the date might not be applicable. If this is the case, we want you to do similar thing. But for the year, you're gonna use what? 9998. Yeah. So instead of using 999, you're gonna use 998. That way we know how to distinguish between the two. How about other data point that are not data point? In SurveyMonkey, we have what? The option unknowing. So when information is not knowing for a data point, you can just select unknowing. For those county or for JC who want to use the data template, you can just use the code 999 and 9, and that is actually stand for unknowing. Yeah, so you can just use that code 9999. Yeah. Next slide, please. There are two ways to submit data back to DHCS. The first way, or I mean, the first option, it is what? Through SurveyMonkey. SurveyMonkey, it is a cloud-based service used to host the CARE Act data collection and reporting tool. Inside SurveyMonkey, we embedded all the logic. So when JC or the county, they are using SurveyMonkey, it only requires the data point that are relevant to the client current care status. Yeah, so it only requires the data point that need to be reported and that associate with the current care status. This option, it is actually for county behavioral health agency that want to do manual data entry. Yeah, so if they want to enter data one by one for each client manually into what the DCR tool, then they can use SurveyMonkey. The second option for submitting data is what? To use a file template and then upload that file template back to DHCS through MoveIt. MoveIt, it is an existing mechanism for transfer of data used by DHCS. Yeah. What will happen is that HMA, we're gonna create a file format that align with the structure of the CARE Act data dictionary structure. So it has a similar structure. County can use that template to enter data and then upload that data back to us using MoveIt. For this option, we also make it available for JC upon request. If JC say that they want to record their data inside an Excel file, then we will make this option available for JC to do that. There are two options. So either you do it through SurveyMonkey or you are using MoveIt. But for each reporting quarter, we only allow a county or we only allow a county or the JC to use only one mechanism. If for example, LA County, right? If they choose SurveyMonkey to do all the data reporting for a specific quarter, that quarter is everything's supposed to go through SurveyMonkey. They cannot choose to do half on SurveyMonkey and then the other half on MoveIt. Yeah, so only one mechanism per quarter. Next slide, please. On this slide, it is actually depicts the reporting period and submission schedule. On the previous slide, we say that county can either submit their data through SurveyMonkey or a file transfer using MoveIt. County can submit the data monthly if they prefer, or they can wait until the end of the reporting quarter. The quarterly data will be broken out by month. The table on the right, it has what? It has the submission deadline. County must adhere to this reporting and submission schedule regardless of implementation date. This means if a county implement in the middle of a reporting period, they will submit their data by the submission deadline immediately following that period. Yeah. And based on what? On the current reporting timeline, cohort 1 county, they are expected to report their quarterly data by month for what? For October to December 2023, by March 1st, 2024. And specifically for LA County, they are expected to submit their data for the month of December 2023 by March 1st, 2024. Yeah. Next slide, please. County BH agency are required to follow compliance standards. Timeliness of data. As mentioned in the previous slide, county must adhere to what? To the reporting and submission schedule regardless of implementation date. Completeness of data. County are responsible for making sure that all the data for all the key participant and elected client are accurate and completed by the reporting and submission date. Once the data has been submitted, HMA on the HMA side, we are going to review for completeness and accuracy of the data. If there are any data error, we're gonna work with the county to fix those data error. Accuracy of data. Inside the DCR tool, we put like what validation rule and we embedded the logic. So only the required data point will show up, and we make sure that they are collected correctly. The file format, we also do the same thing. So we put like validation on the file format, and we also provide a flow chart to how the county actually do like the data collection and the data reporting. And then once we have the data, when the data submitted to us, we're gonna also validate the data one more time to make sure that everything is right. Yeah. And if we still locate data error, then we're gonna be going back to the county to work with them to make sure that we fix those data error. And just for a note for JC and county BH agency, for all the data that's submitted to DHCS, I want to let them know that they can also request for those data, but they can only request for their own data. Yeah. When they request for the data, they only have the data that they submitted. In order to do that, we just need a request either from the JC or from the county. Yeah. They first gonna submit a request to us, and then we're gonna export the data out into an Excel file, and then we're gonna use an existing mechanism for data transfer. Most likely it is gonna be move it, yeah, and then we're gonna use that to like get the data back to the county. Like I mentioned earlier, if a county requests for a data, only that county data can be given back to like the data analyst on that county. Like it will not contain data from other county, and it will not contain data from JC. So, right, next slide, please. Now we will go into the third section of the CARE data dictionary, which is the CARE Act data specification. Next slide. We will spend like some time here, like just to review the data specification section of the data dictionary. You will see that this section right here, it includes all the data point related to the CARE Act. We started from 3.1 reporting month, and then go down all the way to like 3.13. Which is hospitalization and emergency department visit. Both the DCR tool and the file format are built using this order of the data dictionary. Yeah, so it is starting from 3.1 and going down all the way to like 3.13. Yeah, you are not going to be receiving data about 3.13 hospitalization and then being asked data regarding 3.5 service and support. Everything's supposed to follow this order. Next slide, please. And as promised, here is an example of how a data point is being defined using the format that we talked about it earlier. So here we use We use 3.10, which is current care status, as it has been referred in the earlier slide. on this slide though, we only want to focus on the format and know about the detail from this data point, right? So for our current care status, we know that, all right, it is numeric, and the value code is supposed to be what, from 1 through 8. Each value code has a specific definition. Yeah, it is for a specific like care status. We know that information. That means that what, you cannot just enter a random text. If you enter a numeric, it's supposed to be 1 through 8. Yeah, so it will not accept anything outside of that range. So we know that. And then if you look at measurement period and data source, so measurement period, we can see that, all right, it is collected in all measurement period. That means that, all right, every reporting month when the county report the data back to DHCS, they must have this data point. Yeah, so this data point must be reported every reporting month. And then who is actually responsible for getting this data point? We can see under the data source, we can see that county behavioral health agency, they are responsible for it. And since they're responsible for this data point, that means what? It is going to be reported at the individual level. Yeah. So it is going to be reported at the individual level. And then if we look at variable source and then variable source name, both are NA. The reason is that the data element, it is like very specific to like the care act. So as a result, this data point was not derived from other existing data dictionary sources. Yeah. So other data dictionary sources doesn't use this. That's why both section actually end up being NA. And then under the additional specification, we describe like when a change in care status actually trigger reporting of different data point. This indicate what? The branching structure of the rest of the required data. When current care status is updated to reflect a change in status, specifically when a care respondent moved from what? The care initiation process to active services, as like someone with a care agreement, someone with a care plan, or as an elected client, or from active service to termination of support and services from the county. Like if that happened, right, county BH must report different data associated with each measurement period if they occur during the same calendar month. It is kind of confusing here, but we're gonna cover more in detail in the next few slides. Yeah. Next slide, please. We choose like 3.10 as an example, and here we also going to talk about why it is being important. In particular, we want to highlight like the importance of this like data point for data collection and reporting. Inside the data dictionary, you can see that this data point is considered to be part of the basic client information. And from the data dictionary, we have like a bunch of like data point, right? To know like which data point are required, we need 3.10 current care status. We need that. It actually helps guide data collection of required data point. So that is why like every reporting month, county must report this data point. Yeah, because this data point gonna determine what will be required for them to report. So we need that. Next slide, please. So on here, we have a flow chart. This high-level data collection flow chart, it is actually showing how 3.3.10 determine data collection and reporting. Each care status, as you can see in the blue, in the purple box, it is actually depicting a branching structure. As you can see, right, it is going down. That shows like all the data point that associate with it. And from each branching structure, you can see that, all right, not all data points will be required for all clients. Yeah. And as mentioned in the data dictionary, on the first box, you can see, right, basic client and demographic. Basic client information and demographic information will be required for all care respondents that flow through county behavioral health, regardless of whether they end up receiving county BH services. Yeah. for this data point. So once the court has a determination about this position of each care petition, County BH will be asked to report on the care status at the individual level, right? In the data dictionary, this is 3.3.10, which is what current care status. And you can see in the purple box that we have like different like care status. Yeah, those are in the purple box. And based on the client status, all right, it is gonna what? It is gonna require different data point. Yeah. So each of those boxes, you can see it is going down. And as it's going down, you can see that, all right, it's gonna require different data point. And I just want to make a note for the to dismiss status. All right. For the to dismiss status, County BH will not require to track them any further after they report the status, and also the date that they have been dismissed. Yeah. So after we have the status and we have the date, County BH, they are not required to track them any further. On this chart, we have what? We have a full detailed chart, and it will be provided as a resource in PDF form to like accompany this training. And you can download the resource directly from the website in the resource library or on this training page. Yeah. Next slide, please. And as noted before, data during care process initiation period serve as a baseline, and it is only going to be what submitted once. If there is a change in care status during the same calendar month, additional data point relevant to the new measurement period will be needed to report back to DHCS. This applies to like care status change from care process initiation to a care agreement or care plan or an elected client. The same applies to clients who are terminated from county support and services. If this happens, county must report data from the active service period. We're gonna show you an example in the next slide. Yeah. On this example, we have what? A client who started the care process initiation period on January 15, and then ended the initiation period on February 14, right? If the client just go through the care process initiation period and become an active county client on January 31st, County BH only need to report data from the care process initiation period during the January reporting month. However, in this example, we have a client who started the care process in mid-February and entered active service either with a care plan, with a care agreement, or as an elected client on February 14. In this case, the data from the initiation process period will be completed during the month of February. Data for the active period for the calendar month of February must also be reported to capture service provided between February 14 all the way to February 29. And again, when there is a change of status from active care agreement or active care plan or an elected client to termination, counties will do the same. They will first report data from the active service period, and then they're gonna report the termination status and the data point that associate with that status. Yeah. Next slide, please. Now we're gonna basically look at the last section of the data dictionary, which is the Appendix C. The appendix section includes section that is mostly connected to additional specification for some of the data element in the data dictionary. Over the next couple of slides, we want to highlight two key appendices, Appendix A and Appendix B, as they are helpful to orienting people to the overall reporting requirement. We also have like Appendix C to Appendix G. These are additional specification for data point referencing in the data dictionary. This appendices can be located in the Care App Data Dictionary, and we are not going to like show them here in this presentation. Yeah. On Appendix A, it is actually it is listing all the reporting requirement and metric from Statute 5985 for JC and also for County BH agency. It also includes the requirement to like conduct in the independent evaluation of the Care Act. Yeah. Next slide, please, Carly. For Appendix B, it is actually the summary table for all the data element and also data point. Yeah. This summary table, it is actually to assist JC and County BH agency with data collection and reporting. For each data point, the summary table actually lists the statute section code that associate with it, the entity that will collect this data point, the data element that associate with it, the name and the quotient. So from the quotient, you will see how it is being defined, and then the measurement period, like which measurement period are going to be required to collect this data point. We also made this summary table available as a supplemental resource to accompany this training on the website in the resource library and also on the training page. We recommend saving the summary table where it can be easily accessed when doing Care App data collection and reporting. Yeah. So we just finished like the last section of the data dictionary. I will like pass back to Serene, my colleague. Yeah.
Great, thank you so much, Cha and Lauren. So as a reminder, in closing, wanted to remind folks the objectives for today's training. So at the end of the session, we hope that you all will have an increased ability to navigate the Care Act Data Dictionary, be able to describe which care respondents from the trial courts that the county behavioral health will be tracking over time. We also hope that you will now be able to distinguish the measurement periods for data collection and the intricacies associated with those, and also to understand the structure and format of a data element, as well as to really review the data specifications with an eye to standardized reporting. And so, as you will see, our approach to training and technical assistance related to the data collection and reporting will include several avenues to learn more and ask questions. As you see, the data dictionary is a fairly hefty document with many reporting elements associated with it. So this is the first opportunity that has provided an overview of the Care Act Data Dictionary. Additional opportunities include a tool demonstration. So we are planning a couple of live trainings and demonstration of both the SurveyMonkey tool as well as the Move It file upload mechanism. These live training demos will be a good opportunity to learn about how these tools work and to ask questions of the HMA team. We are also planning on county-specific technical assistance, and these will be available to counties on request. The other avenue for technical assistance are the weekly and monthly office hours. So as needed, HMA will be hosting weekly, followed by monthly data-related office hours to support counties in their data collection and reporting. No registrations will be required for these weekly office hours. Anyone can drop in to ask questions. I also wanted to call out the supplemental resources that Cha mentioned during this training. So in addition to the two sources that he mentioned, we will, which are the county data flowchart, as well as the summary table from Appendix B, we are also making available a data dictionary FAQ document, which hopefully will address many of the common questions our team has been getting about the data elements and the data reporting requirements. These resources will be made available on the website in our resource library and will be linked on the training page. Next slide, please. So in conclusion, wanted to call out a couple of next concrete steps. We will be sending out more information about training and technical assistance opportunities, and we want to make sure that we have the right people on that communication. So for those of you who are listening in to this training, please use info@careact.org to let us know who else on your teams should be receiving notices of these technical assistance opportunities. If you can include the names, the titles, and emails, we can make sure to include them in our outreach efforts as these additional training resources become available. Also wanted to call out that the CARE Act Resource Center website has a TTA request form that is specific to data collection and reporting. If you click on the contact dropdown and select data collection and reporting assistance, you will be able to reach one of us with your request for assistance. Next slide. And then finally, just wanted to let folks know we are here to support you and to provide you with opportunities to connect and hear more about implementing the CARE Act. Again, the website is listed on this slide, and our email address is info@care-act.org. Please feel free to reach out. And as we begin implementing CARE Act and you begin collecting data as well as reporting to DHCS, please do not hesitate to reach out to us with any additional questions that you may have. With that, thank you for your time and attention.